Hello? Yeah, I think so. Let me see. Good evening, everyone. Hope you can hear me. Good evening, good afternoon, good morning, wherever you're joining me from. My name is Dumibi, and you're welcome to Parenting with Dumibi. I'm so sorry for having a little bit of delay. Just give me a moment and let's see how we can sort this out. Mm. The PN number you will dial. Mm. What is going on? Oh, yeah, here he is. Okay. So, good evening. Once again, I'm so sorry for the delay. We just had a little bit of issues. We had issues with connection, so I'm so sorry about that. So good evening again, once again, and you're welcome to Parenting with Maybe. So yes, I'm really excited about tonight's live session because we'll be talking about child sexual abuse. We're looking at what is child sexual abuse. We'll be looking at the effects, the types of sexual abuse in children, because the truth is, when it comes to sexual abuse, it is real, and it is happening on daily basis. So we need to know all of this. We'll be looking at the signs, the effects, how we should report if your child is being abused, and what if your child is the one that's abused others, what do you do? All of this and many more we'll be looking at today. And also, I trust that we have time as well to take your questions as well, So I trust and I encourage you to stay to the end so you don't miss out on any of this live session. And I trust our guest speaker to pour his heart to us in regards to teaching us everything he knows about child sexual abuse. And the most important thing is for us to learn so we know how to protect our children, from any sexual abuse. So I'm going to bring our speaker in a moment, but before that, I would like us to. I hope you can hear me. If you can hear me, you are very okay. You are audible. Thank you. Please, I would like you to share the link, share it all over your social media, and if you can hear me, put it in live in the comment section. Share so other people and other parents who can see it and join. And before I bring him on board, I'll quickly, as usual, I'd like you to know who our guest speaker is. So just give me a moment while I bring his bio out. So guest speaker is called Justice Iyawa. So Mr. Justice Iyawa is a Nigerian-born astute public health specialist who has advocated for gender health equality and an expert in humanitarian response. He is a health educator from the prestigious College of Health Sciences, Delta State, Nigeria. He has also badged a bachelor degree in public and community health and a masters in public health, and currently a student of PhD public health at Novena University, Nigeria. Mr. Justice has bagged many certifications in national and international diplomas in international health administrations, disaster management, infection prevention and control, humanitarian basics in microbiology with World Health Organizations, Mohammed bin Rashid University of Medicine, Dubai, United Arab Emirates, and Harvard Humanitarian Academy, USA, respectively. He is a life coach on domestic abuse, relationship, and marriage counselor. Wow, 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 wow. That is who our guest speaker is. So, in a moment, I'm going to bring him on board, and so he teaches everything about child abuse, child sexual abuse. I honestly can't wait for him, you know, for him to tell us everything he knows. So I'm just bringing him on board now. Yes, here he is. Yay! Finally, we got him on board. Your name, Mr. Justice. I am very, very honored to have you here. You're welcome. Hope you're doing well. How are you doing? You're welcome on board. Good to see you.
Yeah, good to see you again. Can you hear me?
Yes, I can hear you very clearly.
Okay, you can hear me very clearly.
Yes, I can.
All right. Thank you very much. Good evening, everyone, and depending on your time zone. And I really want to appreciate Parenting with the Maybe platform, who has given herself that envelope of safeguarding the lives of not only the children, especially parents and potential mothers and fathers. I've watched your clips on how you coaching potential mothers and at the same time even mothers. So I just want to say a big thank you for that health education. However, when we hear the word child abuse, a lot of us will begin to say, this thing is not predominant in Nigeria. I believe it's kind of wild overseas, especially in Canada, United States, and perhaps the United Kingdom. But we have come to realize that when we hear the word child abuse, a lot of people have beliefs and perception towards child abuse, right? Child abuse, popularly known as the CSA, is a serious and prevalent issue. That seems to say that this case or issue has been reoccurring over time, and we've seen a lot of cases even at the legal. We as at last 2 months, we've seen some cases. Anyway, we're not going to talk much about that, but I just want to give us an overview, a background of what child sexual abuse is. Now, child sexual abuse is any form, not one, is any form of sexual activity or contact with a child that is intended. I want us to, because I just want us to understand the concept behind child sexual abuse so that we'll not just oppose it with an adult sexual abuse, or we don't see it to be pedophilia or someone who is sexually abusing an underaged. So I just want us to just listen carefully and underline the thin line, which is intended. So child sexual abuse is any form of sexual activity or contact with a child that is intended to gratify the abuser's sexual desires or to exploit the child for sexual purposes. Now, if I want to go deep into this definition, it just simply means that the abuser the abuser's intention is to satisfy or gratify his sexual pleasures or any other sexual purposes. It could be contact, it could be intended. And a lot of us we see that until you forcefully grab a child and have carnal knowledge with the child, that is only where you see that sexual abuse. When you use child sexual abuse does not necessarily mean you must have carnal knowledge or you must have penetration with that child. And when an adult is having an affair or sexual intercourse with a child, you refer to that person as a pedophile. But there are other forms of sexual abuse that we actually need to understand. Now, majority of us here, anyway, there will be a time for Q&A, question and answer, but then majority of us has experienced child sexual abuse or have seen child being sexually abused. I just want us to understand that there are various types of child sexual abuse, and majority of us, maybe after knowing the first or second type, will know the one that we are actually experiencing or the one that we have seen people perform. There is this type called the penetrative abuse. Penetrative abuse. Penetrative abuse is one is rape. And let me also define this rape in this context. Any man or a woman, because we've also seen ladies sexually abusing small male children. So any person who forcefully, without, of course, we know that the child does not have consent because he has not gotten to the stage where the child will have his or her own will, volition to say, okay, no, this thing is right or this thing is wrong. So that penetrative abuse comes with rape. It means that it is um, the child you are abusing does not give consent. Automatically, a child will not give you consent. But we refer to
Does
penetrative
not give
abuse in
consent.
form of rape.
Automatically, child will not give it consent. When we
All
refer,
right. Then
Yeah.
sodomy. A lot of us have heard sodomy, but sodomy is just a sexual act that involves oral or anal, or perhaps we could refer it to as bestiality. Hello, can you hear me?
We can hear. Yeah. Okay. Yeah. We can see you now. We
All
didn't see
right,
you before. Yeah.
all right, all right. So we have the first one, which is penetrative abuse that comes with rape, that comes with sodomy, or any form of penetrative abuse. Because a lot of us we only see penis and perhaps vagina as penetrative. A lot of these abusers go through sodomy in form of oral, in form of anal, or in form of bestiality, where you see an adult bringing animals to have sexual intercourse or sexually abusing a child. They see it as fun. All right. So this form is a type we refer as penetrative abuse. It's a type of child sexual abuse. But majority of us we definitely come to realize if a child is sexually abused when it's undergoing or when it's undergone the penetrative abuse. But there is this other type that is predominant that a lot of parents do not even care about. They don't even know what is happening to the child. But these children have been sexually abused by either their mates or perhaps older children or adults. And this type of child sexual abuse is what I refer to as non-penetrative abuse. This non-penetrative abuse comes with touching. You see, oh, my brother, how are you? You sexually touch these children without their knowledge. And this is where parenting with Dumebi has come to stay as it regards to awareness. Because this is time for parents to open their eyes to see how adults handle their children. For the man or the mother, you don't even know that a child sexual abuser could be in form of siblings, could be in form of family or perhaps friends, without the parents even identifying it as a form of sexual abuse. Not only touching, fondling. You see parents who say, "Oh, this is my brother, this is my sister." You hand over your kids to them, and at night, what do? You see their kids that is not yours. Even if we've seen parents even sexually abusing their own kids, you fondle them or you touch them, you caress them sexually, and other form of non-penetrative abuse. I made mention of um, touching. I also made mention of fondling. So number one is penetrative. A majority of us do not even know that until there is physical evidence before you know that, oh, my child has been sexually abused. But 60 to 65% of children who have been sexually abused do not undergo this penetrative. 60% of them are non-penetrative child sexual abuse. Another form or type of child sexual abuse is exposure. Exposing a child to explicit sexual content or behavior. Gone are the days. I could remember in our days where we didn't get to see all these social media platforms and all that, but where parents, whether knowingly or unknowingly, give their children smartphones. And I know that technology has also brought about what we call as is it parent guidance, where you can um, streamline what your child can view. But how many parents have that time to circumvent what your children can view? So exposure is another type of child sexual abuse because one thing we should also understand is what we call non-penetrative and penetrative. But these children can be sexually abused by just viewing sexual content or pornography unknowingly to them because when they grow, there's a stage we call the epinephrine stage in child development. Whatever comes into their head, it sticks. And when they see something like that, Why they grow, they want to exercise it. Or when they see something similar that their baroreceptors have been implanted in the part of the brain we call the diencephalon, immediately that content resurfaces, the child grows to see it like, no, I want to go back to it. So we should learn how or what we allow our kids or our children to watch. So exposure to sexual content is also a type of child sexual abuse because those persons are abusing people by in form of video, and these children tend to watch it and they want to practicalize it while they grow. Then another form or type of child sexual abuse is what I refer to as grooming.
Mm.
That grooming simply means manipulating or coercing a child into engaging into sexual activity. That is, there are kids who does not necessarily know what they are doing. We've seen cases in US where in fact, they've even banned child pornography because they feel that the thing is actually affecting their kids. But we'll come to where there are litigations against child sexual abuse. Then the last but not the least, which is what I refer to as sexual exploitation. Have you seen situation where out of poverty, illiteracy, these children at the age of 6, 7, a brother will come and say, brother, how are you? What did you bring for me? In exchange of peanuts, candies, they say, I come to my place. So they sexually exploit these children and they also do what we call commercial sex. They pack all of them to another state, to another country for money purposes, for profit. So those form of sexual abuse are the conglomerate of everything we need to know about child sexual abuse. Now, let me bring us back to statistics. In Canada and Nigeria, to be specific, we have seen cases where, as at 2023, reported child sexual abuse were up to 17%. In epidemiology, for those who are in epidemiology or public health, 5% incident rate is like when you juxtapose it to maybe statistical value, it's like you are saying out of 100,000 population, you are having 100,000. We're having like 3 to 4,000 reported case of child sexual abuse in terms of percentage. So it means that this thing is increasing. But as at 2023 down to 2024, due to health education, due to prosecution of these abusers, the case is gradually reducing. We've seen less cases like before. Now, the real stuff, or why we are talking about child sexual abuse, is how will I know as a parent what are the signs or perhaps symptoms of child sexual abuse? First, I categorize this thing into the physical signs. And the physical signs you will see if your child is sexually abused is one, you're going to see injuries. When your child comes back from school and you say, Mommy, Daddy, my back is paining me. Yes, be serious about the complaints of your wards or your kids or whosoever that is under your tutelage. You must be able to see injuries, pains, discomfort in the genital or anal area, because most of these people, they don't even have penetrative sex through the vagina of these children. They go through the sodomy, they go through the anal, because when you go through the anal, a lot of parents may not even know how, or may not even, they may feel maybe the child is having difficulty to pass physics, hence is having pain. But we as parents, we should try as much as possible to look out for the physical signs in form of injuries, pains around the genitalia of these of our kids or children. Then another one we should look into is behavioral changes. Behavioral changes. Now your child is gradually withdrawing from you. He has anxiety. We've seen cases because a lot of these a lot of these children who are sexually abused undergo what we call child depression. You will just see this person. He's a playful person, you see, but he start withdrawing. You begin to wonder, is it cognitive development? Then while you are unable to see those physical changes in form of injury and pains, you should watch the behavior of your kids. What has happened to you? Assuming I have a child called Elami. Elami comes back to school. First and foremost, what we do is, how are you? Did you defecate? How did you, do you have any pain? We psychologically assess these children. Then before we start going into physical injuries. So a lot of these people, before you know it, they become aggressive. They become aggressive. What is happening? This is not my child. You should take note if that child, because a lot of people, they may not even find it difficult to speak because they don't even know what happened. But by their behavior or their signs, you should be able to detect. And when you detect, anyway, we'll get back, we'll go to how we can be able to address this situation. Then another sign is emotional changes. Emotional changes. You see this child having fear or guilt, shame, or self-blame. You begin to wonder, why is my child having this? There are some kids, when you give them some candy, normally these are things that they actually love, and it is their favorite candies or food. When you give it to them, you see some level of withdrawal, rejection. What is happening? Don't just say, "Mm, it is just a child." Yes, after 2, 3 days, this child will definitely pass because the stages is fast. He will no longer, or she will no longer experience those emotional changes, and she will bounce back as if nothing happened. But we need to take cognizance. We need to be careful. We need to watch closely on our kids. I don't actually want to take much time, but who are these perpetrators? If I ask you, who are the perpetrators? Perpetrator is not far from us. Could be our family members, our neighbors, our teachers. Parents is not excluded. Step parents, siblings, or other relatives. Now, research made us to understand as a 2020-2021 survey of sexual abuse. They categorize it into child and adults. But that of the adult, we were made to understand that those people who are sexually abusing these children are step siblings or step parents. They have this mentality or notion that it is normal child. So whatever I have to do with this person is at no consequences or no effect to me. But that does not mean that parents do not also sexually abuse their children unknowingly to them. And those who know, they also carry out this sexual abuse. Family members, another set of people who have been sexually abusing children are caregivers, nannies, caregivers. And we've seen cases because of the proliferation of this sexual abuse by caregivers or nannies or whosoever that you are paying to take care of your child. You have CCTV cameras to actually know what is happening at home. Now, caregivers is not out of the radar. They are key as perpetrators to this child sexual abuse. Then strangers too is not excluded. Individuals who treat children for sexual exploitation. And do you know that um, strangers that we only concentrate on strangers? No, don't come to this man. No, 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 we don't know him. Please stay away. Whereas people within are the one perpetrating this. Then the other set of person I can say maybe are the peers, other children, because they don't know. They will see the genitals of the child. They say, "What is this?" They will hold it. They will touch this because of what they are seeing. Because peers, whatever they see or watch, whatever they hear, are the things that they come to school and they want to practicalize. They want to actionize all those things that they have as well learned in social media platforms. Now, what are the risk factors? Who are those persons who are hello? Can you hear me?
Yes, I can hear you. Yeah, well done. I can hear you
Hello.
very clearly.
All right.
I can hear you very clearly. Yeah.
Now, those persons, all right, all right. Now, there are a set of persons who are prone to child sexual abuse. There are a group of persons, or can I say, in fact, in fact, they have been categorized in form of risk factors. Risk factors here, I'm trying to say, those persons who are vulnerable to these child sexual abuse. Number one of these risk people, those people who are under the risk factors, are the age groups. Children under the age of 12 are more vulnerable to child sexual abuse. Under 12 are more vulnerable. That does not mean that above 12 are not vulnerable. But statistics has shown, research has made us understand that they are more vulnerable from that is below 12. Then the gender, the male or female, girls or boys, without even going deep, the girl child are more prone or vulnerable to child sexual abuse, the CSA. The girl
Mm.
child is more vulnerable to child sexual abuse. Then the other form of people who have been sexually abused are those who are in form of, we refer to them because we don't actually refer to them as disabled, in form of disability, because we have a commission called people living with disability, because they do not have the will to withstand or to speak. These people are predominantly sexually abused. Children with disability, you see a child who can't speak, who have congenital deformity, who can't see, these people are vulnerable. A lot of perpetrators, abusers, they prey on these people because they know that they may not be able to speak, or they may not be able to exercise or express the effects of CSA. So these people are prone. So when you see more cases of CSAs, they are actually those people who are referred to as the people living with disability. Then the family dynamics is not out of place. Now, we've seen cases, when I use the word family dynamics, we've seen parents who are not together, right? Um, the father is somewhere, the mother is somewhere. Some people will teach you how to train your child. And perhaps because they are not theirs, they don't actually give 100% guidance or watch over those kids. So children from dysfunctional or chaotic families are more at risk because when father and mother are together, they come together and watch over their kids. All right. So family dynamics also play a role in the vulnerability of these children experiencing sexual abuse. I will wrap this conversation with the preventive strategies. Um, in my years in the health sector and research, if you do not proffer solutions to an epidemics, epidemics will come again. And when it comes, it's coming in full force. So we need to know how can we prevent, what are the preventive strategies on CSA. One, and let me also repeat, the host has done 90% of preventive strategies. This platform with which she has established and educated millions of Nigerians, or millions of, in fact, people all over the world, because it's not only Nigeria that is watching. We find people who are tuning in from Canada, UK, and US, Germany, and other decline. Now, education is the key. When you are not informed, you are deformed. And when you are deformed, you can't perform. So, health education or education as an umbrella is solving 80% of CSA. Teach your children about healthy relationships, boundaries, and consent. Now, I've watched parenting with maybe there's one particular, I've forgotten the topic when she was talking about when they touch your child here, seek consent, say no, don't touch me here. When they touch me, report. We've seen cases like that in schools where teach people are taught, including the teachers and the children. Whenever they touch you in this place up inappropriately, please tell your dad or tell your teacher. So that as well is a preventive strategy. Then parents, you must supervise. Supervision is a key. You must ensure adequate adult supervision in childcare settings. And I'm very proud whenever I watch this program. I sometimes begin to see um, the humanitarian service the host is giving to the world. Because whether we like it or not, education is costly. When you see someone who take out her time to say, I want to give, I want to make impact, I want to leave this narration, I want to become a generator to this generation, a centurion to this 21st century. That is what the host is doing. And that is why I was glad when I was invited to speak, because as a public health specialist, if I do 60% of my job, just like what the host is doing, we'll find less patients in the hospital. You'll find you'll find in fact you're not going to find an obstetrician or perhaps a gynecologist or a cardiologist to operate on the heart or the tummy of a mother or a child, because a lot of people, when they have carnal knowledge to a child, before you know it, there's what we call VVF, vesical vaginal fistula, where the there's a tear from the anus down to the vagina, and the sphincter, the nerve that is supposed to tell the child that I want to wee wee, I want to urinate, is dead. So you have what we call urinary incontinence. So that urge for urination is dead. So you, when we do our jobs to prevent it, the doctor will not suture, will not cut those babies. So the host, I want to also use this medium to actually appreciate you, because you have started preventing child sexual abuse by hosting this program. So thank you very much. Then another thing is screening. We must conduct thorough background checks on caregivers and staff. Before you employ, you check histories. Where have you worked? What have you done? How can we make sure that this child is well taken care of? So all these are preventive strategies. Then you must be able to support, provide emotional support. You know, there are some parents that are not around. They are the career women. The men, they are the career men. No, let me leave, let me leave every work for my wife or for the mothers. No, It's a joint effort. It's a joint effort. So there is no responsibility that is saddled for only the mothers. It is a joint effort. So let us give our children that emotional support. Let us give our children that screening and observation and bring them close and tell them that I am still your friend, irrespective of the fact that I'm your parent. I'm still your friend. Tell me. By then, you'll be able to reduce, if not eradicate, child sexual abuse. Or let me put it this way now, how can we report or respond? You know, the reason why we are still having proliferation of rape cases is because a victim who has been raped, the parents or even the victim will say, no, I don't want stigma. I don't want to be discriminated. Because if I report this case, I will be made known and that stigma will be there. So let me just die with it. A lot of them are still passing through PTSD, post traumatic stress disorder. So, but for us to fight CSA, we need to have what we call mandatory reporting. Report suspected CSA to authorities. Do not say, no, let me cover it. Don't cover it. When you cover it, you are exposing these children. So when you talk evil, when you speak evil, evil reduces. But when you hide evil, evil multiplies. So we must be able to report CSA cases to authorities. Because I believe, I know for Nigeria, I know the one for UK and perhaps Canada, because I'm always conversant because I have a lot of friends and have bilateral relationship with UK when it comes to health system strengthening. But then we need to report these cases. Because if you can report CSA, you can report ASC, that is adult sexual abuse. So if you cover child sexual abuse, you can cover adult sexual abuse. But we must learn it from the scratch that whenever we see any sign, remember how we can identify. Whenever we see any physical injury or my child is not acting well, first and foremost, go to the school, make formal reports. Then when this thing comes, then you go to the authorities. Then confidentiality, maintain confidentiality to protect the child and family. And I want to buttress on this confidentiality. That does not mean that you need to be, I'm going to put it, say, no, because this is the abuser and it's my person. Let's just make it unofficial. Let's just hide it. No, it means that you must be able to protect that confidentiality. Simply means give that your child confident to speak whenever he or she sees any form of this sexual abuse. Give that child confidence. Let the person speak that you are who you are. Don't hide it. Don't be scolded whenever you want to speak. And mind you, it also increases their child development, cognitive. Because when a child sees something and reports, he can as well see something and speak. I don't understand this. I want to learn. So always tell your kids to have that confidence to speak. And we must also have these supportive services like provide access to counseling. And every of the section I'm speaking, I'm also appreciating the host because everything that I'm speaking, the hosts have in other climes, people will say, no, let me bring this host to Uganda to speak because it is expensive to counsel because it's not free. And when you see free things like this, you grab it. Because when money is attached, it's okay for you to be in this section, you're going to pay some little dollars, you will see people getting interested. But most time, things that are free or lessons that are taught that does not require money, those lessons or informations are vital. But a lot of people do not even come to you because it is free. So if we don't report, we have consequences. If we don't report these cases, we have consequences. The consequences is just physical harm. We already understand that the signs and symptoms. is already a physical abuse. And when we keep our mouths closed or shut, I tell you, we are going to have crisis cases, proliferation of CSAs. Now, the host is a counselor, and I believe she has produced a lot of counselors, or a lot of counselors are actually watching her, and she is a role model to people. And I also want to use the opportunity to say that we have the healing and recovery stage, and parents who have seen or have had cases of CSA from their children, or you want to actually do this healing and recovery stage. And I believe this particular one is actually for counselors, but I will use the opportunity to say that. And I believe my time is almost running. So to wrap it up, we must learn to provide access to counseling and therapy to help children process, or at the same time process their experiences, and at most have a support group, teach them, make them know that the world is so nice for you not to report CSAs. And we should also provide medical care, ensure access to medical care and treatment for physical and emotional injuries. Now, if, lastly, that is my word, if you or someone you know has experienced child sexual abuse, there are resources available to help. In Nigeria, you could report to NAPTIP. NAPTIP simply means National Agency for Prohibition of Trafficking in Persons, or the National Commission for Refugees, Migrants, and Internally Displaced Persons. They also treat cases of counsel. Then in the United Kingdom, you can report your case to the National Society for Prevention of Cruelty to Children, NSPCC. And maybe after this section, I could send the contact for those people living in UK. Then local authorities such as Child Protection Services or law enforcement. You can go to any law enforcement agency and report child sexual abuse. And I also want to wrap up by saying, if we raise our hands up, we can fight child sexual abuse. If we want this country to be better than where we met it, we must report child sexual abuse. Thank you very much for your time, and thank you, the host, for having me. Thank you.
Wow, 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 wow. This is such a powerful section. Honestly, we can't thank you enough for pouring your hearts. I could feel the passion, while you were speaking. So thank you so much for teaching us everything about child sexual abuse. So if you have any question, can you please put it in the
Thank you
comment
very much.
section? So I believe you can take one or two questions if you don't mind. Yes? Hello, can you hear me? Mr.
Yes, I'm
Justice.
here. Yes, I'm here.
Okay. Are you able
I'm
to
still
take
here.
one or two
Yes, I can
questions?
hear you very well. I can hear you. I'm here.
Okay. Okay. So
All
thank
right.
you so much for that was such a powerful one. So I want to so there's I stumbled on a video on YouTube, and the video in fact it was even the title of the video that got me to click on it. And the title of the video it says I married a monster. So I clicked it, and this was a lady that was talking about her husband molesting her. I think her daughter should be about 3 to 4 years old. So she said she just carried the child to change the nappy, and then she saw there was a cut. So she asked the child, "What happened to you?" And the child said, "Daddy." So so that got her very, very uncomfortable, like what's going on. And she herself, she's she was she's
Mm,
been abused herself. So she said she just could not believe it and everything. So I went down the comment section because the video it had loads, millions of views, right? So I went down the comment section and I saw a lot of people were accusing her. Why would she come up? Why would she come online to say it? Why some were applauding her for her confidence, although according to her, she reported it immediately, you know. to the police, and authority took her child to the hospital and all that. And then that was even when she realized that it was not just the daughter, also the other
Mm,
sisters were the sibling, you know. So for her, it was a very horrible experience because she, according to her, she's been very, very possessive of she's been very possessive of her children and all that. So my question now is, a lot of people were accusing her. Some applauded, very few applauded her for her courage for speaking up. But a lot of people were, why would you speak up? Don't you know you are going to damage your child and all of that, your child confidentiality, your child safety? Why not putting all of those things into consideration? So what do you think about that her situation? Do you think it was right for her to come on air to express herself? Because the thing is, a lot of people are not expressing it. A lot of people are not speaking up because of, like you said, stigmatization, and all of that. So her coming up now to create, should I say creating awareness or just speaking up? Probably, I don't know. What will you say in that regards? Do you think it was the right thing to do?
um, Discrimination of any form of abuse, huh, is not a strategy to preventing abuse, or the fear of what am I going to lose. This is the problem we are having in the country, or rather in the globe, is because um, a father who is sexually abusing his kids, first and foremost, that father needs to be checked,
No, I think it wasn't.
need to be
The children are
examined.
not his kids. Yes, I think they are not his kids. Maybe they are his step
Okay,
children. Yes, yeah, they are not his kids. They are not
okay,
his
fine.
biological
Yeah.
kids. Yes, according
All
to the
right. Okay. Now um I want to use the opportunity to appreciate, give kudos to that lady, because what she is to gain in the marriage is not to be compared to the emotional turmoil and damage. See, for ladies, anyways, I have a lot of articles on rape, and we have seen people who will tell you that they have experienced rape.
Hello.
Hello, can you hear me?
Oh yeah, we can hear you now.
I think I have issues.
I can hear you now.
Hello, can you hear me?
Yes, we can hear you. Hello, are you there? Hello. I think it's frozen. Hello.
Hello,
Yes, we can hear you.
hello, can you hear me?
Yes.
All right, I think I had bad reception. All right, I said first, the lady has taken a bold step to fight CSA, and if you ask me, I will tell you that that lady should be given an award, because not
Mm,
every woman
mm.
would want to gamble her marriage with what she just experienced. And I want to cascade it to a rape victim. Like I said in my introduction, I said the reason why we are having proliferation of rape case is because people are not speaking. People are swallowing it because of what will people say. In fact, she already knew that people will come for her to say, no, why are you saying this? Those persons that are saying that, why are they saying this? Is because it has not come to them. They've not experienced what. Now, she is emotionally traumatized. She's passing what we call PTSD, post traumatic stress disorder, as a result of what the man did. Imagine if that lady is, sorry, the child is the lady's child or that man's child. Maybe there's someone who knows. I tell you that man needs to be jailed. There are litigations. In fact, there are laws prohibiting. There are laws saying that when you sexually abuse a child, you go in. I believe it's almost the same thing with rape. That's 21 years imprisonment. I don't know for other laws in the other climes, but I must say that that lady did a very good thing because the purpose of what she just did is for the liberation of the world. People will watch and say, yes, if this woman can speak, I can report cases too. Let me just tell you, when I had the Society of TB. Anyway, let me use the opportunity to say there was a time I had tuberculosis I didn't know, right? So after that, I survived tuberculosis, and a lot of NGOs started calling me to go to different parts of the country and sub-Saharan Africa to speak. But do you know that immediately I came online to say I'm a TB survivor, the DM I got was up to like 13,000. So I never knew. You're a TB survivor. I never knew. I am just taking the drugs. Then, or I just knew someone who just died, or I was diagnosed of TB. And when you tell them that, look at this, and they say, oh, so somebody needs to come out in the social media to tell them that yes, we are reporting this case, and not only reporting, it must go down to prosecution, not just reporting. They must see the consequences. That man must go to jail or must be prosecuted so that we can have what we call cultural change. We can know that, oh, when we try something like that, will serve as a deterrent to others. Because I do not subscribe to people trying to cajole, trying to beautify rape case or any form of child sexual abuse. Thank you.
Thank you for that. And then same in that video, another thing I noticed was a lot of people said speaking up in that comment section. Yeah, I was raped when I was a child. Some said a lot of people, and when you were talking about the risk factor, when you said girls are most vulnerable, I believed it because in hello, are you still here? Hello, has network knocked you off again? Yeah, here he is. Hello, can you hear me? Can
Very
you
well,
hear
I can
me?
hear you.
Okay. So a
Very
lot
well, I
of
can.
okay. So most of them were female that were speaking up. Oh, I was raped, I was abused by my uncle, my stepdad, and all of that. But some things got me wondering. Some said they did not report it, they didn't tell anyone up until some like until date. They did not tell anyone. Some said it was later on they spoke up. And some said their mom, they told their mom, but their mom did nothing about that. You know, their mom, some said their mom too did not believe them, you know, especially those of them that said their mom did not believe them. I could feel the pain. It was even from that video that I'm like, oh, we must address this issue. It was after watching that video that I said, oh, okay, I think this should be my next topic for a life next topic. You know, I could feel a lot of
Yeah.
people were like,
Uh,
their parents, their mom especially, they did nothing because of their financial gain.
yeah. And
They don't want the man
uh,
to be in trouble and all of that. And I could feel the pain from these young girls, what they would have gone through. You know, some they said their mom even beat them, you know, even they didn't believe them. Some even got beaten because of it for even speaking up in the first place. So how do we address
yes,
all of these
exactly.
issues? Yes.
All right. You see, the problem we are having as a race is trying to cover, trying to be nepotistic in our action. Now, it's my father. If you report another in jail and now, who go they provide money? Who will be giving us money? Who will be sheltering us? So let's just keep it. See, there's what we call reprisal approach. Now, um, because I always use rape to juxtapose CSA and ASA. Now, a lady who is raped, three things happens. If that rapist is not prosecuted, hmm, the lady did not have justice.
Mm.
Maybe she spoke and she's declined. parental
Or
pressure.
did
I
not
beg,
even
leave
believe her.
leave it
Yeah.
this way. Let us do it this way. Yeah, most of them would not even believe. Or
Mm.
especially when the lady is the one that met the lady, especially when the lady is the one that went to the man's house. They say, "No, be you. Are you not the one that took yourself to the man's house?" Now, if that lady does not have justice, three things happen to the lady. Number one, the part of the brain that would that is responsible for memory, coordination, and memory coordination and improvement. This lady we either hate men, hmm, never to do anything with the man. Some set of this victim would
Network again. Please bear with us. We are just, if you've got any question, please feel free to send it down to the comment section, or you can send it to me privately. It's absolutely fine.
hello, can you hear me?
Yes, I can hear you now.
All right. So what this so this victim we either hate men for life or they become lesbians. They will tell you I don't have anything to do with a man. Or after the rape, they will develop what we call the BDSM. They become sadist or masochist. Submissive to say they will intend to see because that force, that act will stick in their brain. They will become something that is pleasurable. So from rape to pleasure. So they will never have sexual um, pleasure without pain. They must have, for them to have that pleasure, they need to act as if they are being raped. So these people become sadists. There's what we call bondage, dominance, sadism, and masochism. So that is where you see this rape victim, oh, they grow to start enjoying being flogged, being tied in order to get that satisfaction. So I want to juxtapose this rape to this child. This child will grow never to discuss whatever is happening to their parents any longer. Or they will grow to see it as a normal thing.
Mm.
So this is the effect, these are the consequences when there is no reporting, when you can't stand and say this thing is wrong, irrespective of the person who has committed the crime. Because in a country where there is no law, or in a country where there is no cultural change to say no, because the problem we're having in every, because I don't want to personalize my country, the problem we're having in this world is that we don't report evil because the person who commit the evil is my person. And that is why evil will continue. That
Right.
is why evil will continue to perpetrate. So we must learn how to report case. If I have that lady's number, I need to take her contact and send her details to NAPTIP for a national award because it's not easy, and we must start. And that is what the host, that is what you are doing. Speak out. Because now a lot of people say, let me not go to social media. Let us handle it. No. If you say let us not go to social media, you have not done anything. Tomorrow you will do it again. You will do it again. So that is just my take there. Always report the case.
Okay. And how do you now answer, or what do you say about the ones or the victim that don't even tell maybe their parents or anybody, they just keep it to themselves? Well, how do you handle that
Okay.
situation?
Now
Because I still saw a lot
those
of comments in that
yeah,
section where I didn't tell anybody, I just kept it to myself. So what
okay.
could have happened?
Now,
What would have made them not to report it?
okay. There are persons who are introverts. There are
Mm,
persons who, whenever they speak about what is happening to them, it's simply because maybe they have been scolded before not to speak, or there are some people, based on
mm,
their parenting from child, they are introvert, they hardly speak. And that is why parents need to engage children in order to see them not only as friends, because I see children who don't talk to their parents, but they have confidence in their peers or another person. So
mm,
that confidence are the people who are perpetrating this evil because they can talk to them, they are close to them, they can easily woodwink them and perpetrate that evil. So to me, if you are a child or you've grown past that stage, maybe you were once sexually abused as a child and you are now an adult, you have kept that in your mind. One thing I will tell you is that you are still passing through the trauma. It's psychological. When that trauma reoccur over and over again, you could go into, I don't want to go deep about the mental health. I tell you, it's going to affect your daily life. Until you speak out, until you speak out, you are not free. Until you speak out, you are not free. And most of these sexual abuse victims, they become outspoken tomorrow and speak about it. So I want to encourage these people, even if you cannot identify, if you can come out, because there are thousands of people who are watching you. There are thousands of people, if not millions, of people. Are you there? Can you hear me?
yes, I
We're
can hear
having
you.
poor reception and it's actually
I
appalling.
can hear I can hear you funny enough. Hello? Mm. Are you still there? Please bear with us. I think network has knocked him off again. So let me see if I can bring him back again. Um, Meanwhile, I hope you're enjoying this live session. I hope you've learned anything. I hope you've gained any value. What have you learned? Can you please put it in the comment section? What is your take home? What is that? I guess it's his network. Let me take him off and see if I can bring him back again. Yeah, let's see if he can come on board again. Okay, I think he's gonna. Mm, This is your take home. Have to when he's back. Yes, I think he was about to answer the question of why some people don't report, some children don't report, While I shared that video, when I went to the comment section of that video, the video is I married the monster. It's on YouTube. It has millions of views. I decided to go down the comment section and I saw it was from that video. I said, oh, we need to address this because a lot is going on out there, you know. So it was from that video a lot of people they said they did not speak up. A lot of people, and I've heard series of cases, where people said they did not speak up. They didn't tell anyone. They just kept it to themselves. So about to address it. Why do people? And he was trying to say that why most people don't address it. He was linking it to parenting, and I could see reasons with him where some children, while they were growing up, they were not allowed to speak up. Their parents always shut them down before they speak, keep quiet, who are you to talk, and all of those things. So all of this shutting of down, you're not giving your children opportunity to speak or express themselves. It has a way of affecting a child. So when these things happen in children, if a child that doesn't speak up or you did not allow to speak up while growing up, even an adult will not speak up, they will not be able to express themselves. So when these things happen, they will still not speak up because they are not used to speaking up. You shut that ability for them to speak up. So that's why a lot of people they don't speak up. So now we can see how important our intentional parenting can be, or being intentional in our parenting, because it will help us know how to raise our children, how to let our children express themselves. We always talk about the importance of communication, spending time with our children, because it is through spending time you give your children opportunity to express themselves, to speak up while maintaining eye contact. Let them express themselves, give them that room, because it is through speaking up, through that one-on-one relationship, you can know what is even going on in their mind or in their life. If you don't give them that opportunity, they won't be able to tell you. And sometimes they might just say casually, without even, but to you, they pass a message to you, and then it's an intentional prayer. That is when you now know how to address it or how to manage it. So I will encourage every one of us to be intentional. Intentionality is a core thing when it comes to raising a child. There is a way to raise a child. It's easier to just carry a child for 9 months and give birth to them than to raise that child from 0 to 18 years old. So I would encourage it's still not, I don't know what's going on. Okay, so I would encourage each and every one of us to be intentional in the way we raise our children. And as a parent, another of my take home is, as a parent, if your child is involved in sexual abuse, speak up, irrespective of what is at stake, irrespective of your financial gain, whoever the person is, your husband, your partner, whoever, your relation, uncle, and all that, whoever it is, speak up. Because speaking up, you are not just saving your child, you're also saving other children. And also, you are helping your child to heal. Because if your child doesn't get justice, it has a way of, you know, affecting your child emotionally. Emotionally, he was trying to use some terms that I cannot even pronounce. It affects your child emotionally, and not just, and it affects them in their adulthood. So always speak up, seek justice for your child. Seek justice for your child. It is very, very important. I remember when I talked about what's it called? 5 love languages, when we talked about it in one of my live session on YouTube. And I started with a story of a child that love language was, I think, was it out of service? No, I think quality time. Yes, that was it. For his parents, they missed it in that regard. They didn't satisfy that need for the child. And what happened? The uncle who came to live with them, he understood that the child had a need that was not satisfied. He understood that the child's emotional tank was not filled by the parents. He took advantage of it and he molested the child for months until he relocated to Canada. And because the child could not stand it alone, the child felt neglected, the child felt empty, the child felt, oh, the person that was, satisfying him is gone. She couldn't bear it anymore. And, you know, she just ended her life. So that is the thing. We have a role to play when it comes to, child sexual abuse as a parent. There are so many signs that he has identified. If you miss it, you can always catch replay. He talked about so many signs to look out for. He talked about the risk factor, who are those that are more vulnerable. There are people that are more vulnerable. And he also said that our girls, they are more vulnerable in as much as boys seasonally molested. Girls too, according to him, are more vulnerable. So a lot of things have been said tonight, and I hope we'll be intentional in how we raise our children. And I trust that we'll do the right thing by raising our children and by helping them, in order for them, protecting them jealously, guiding them, who are the caregivers, who are who are people in their life, your relations. And another thing that he said that struck me was when it comes to sexual abuse, it's not far-fetched. These abusers, they are not far away. They are within your relations, your uncles, friends, family well-wishers, caregivers. So these are people we need to watch out for. So, and also is our role as a parent to teach our children boundaries, what they should look out for, appropriate touch, right touch, bad touch. Just teach your children all of these things. And I trust that when we do all these little things, our children will be able to know if something is not right, and they have that ability, that confidence to speak up, to tell us, because when they tell us, and then we too will be able to play our own role by reporting it without covering it. So I hope someone has gained something tonight. So we're about to, I think I'm sure he's still having the network issue. So we'll call it a day. Any more question, you can send it to me, and I'm happy to forward it to him. So, and I know he will always answer. So, I hope you've learned something. If you've learned anything, gain any value, can you please put it in the comment section? Yes, ma. Put it in the comment section. Let's see the girl child. Yeah, the girl child, absolutely. Healing and recovery still. Yeah, there's always a healing. And then there are people to report to and all of that. So, thank you so much for organizing. Thank you. Thank you. Love it. Thank you so much. I appreciate, and thank you for joining in. Thank you for your time. I really appreciate you. And let's do this thing. Let's do it again next time. So yeah, we'll call it a day now. Thank you and have a good night's rest. Bye.